I have to tell you that I've got Julianne really nervous because I said I was really going to pick on her this afternoon because she is the president and we've shared some interesting conversations over time. So I am going to start with Julianne first of all. So Julianne, I want to hear from you your reflection on leadership, what your vision is, and perhaps just in a couple of minutes what you've found has been difficult and what has actually helped you through over the last couple of years in particular.
When this is put to you, it's really difficult to think about where it all starts. But I guess that when Rosemary spoke this morning about I was one of her student nurses, what she didn't tell you was I was the one outside of her office all the time, contemplating which lecture I was going to get next. So, and you know, my mother would say, well, that was set in stone to start with. And you know, like I was definitely I was captain of the A grade hockey team, but I was never going to be a school prefect. So my journey has sort of always been along that path, I guess. I think that nurses that endure, nurses that last through the systems that we have, and I think internationally, within those nurses that have endured, you know, the qualities of leadership. And I think that, you know, they're either nurtured or they happen through crisis or situation. And I guess my journey has certainly been up and down all along. There's always been something that inspires you. But at the end of the day, it's well, what next? We've got this far, let's go next. What's next?
So I would ask you then, you've come from a relatively small rural general practice in rural South Australia. So how did you end up the president of the national organisation? Just quickly, how did that happen for some of the younger nurses?
Well, it certainly happened because I came into general practice nursing. I was pretty much dragged out of the local OR because there were initiatives happening in general practice and they suddenly needed nurses on deck. And I guess they could see that I was a bit of a doer. So I was dragged in and I was thrown into this very strange environment which did not fit with what I was used to as a midwife or as an OR nurse, and went seeking help and found this wonderful bunch of nurses who had started out pretty much the same way around the table saying, this is crazy, we need to support each other, we need to work it all out together rather than trying to do it individually. So I joined APNA. And from very quickly was on the board.
So I think that's an interesting reflection. So really, leadership born out of a need to actually congregate together to support each other.
Absolutely, it was about support. It was about learning together and not trying to recreate the wheel. Let's share and conquer and divide in some ways, I guess.
Yeah, excellent. Okay, thank you, Karen. You spoke so well, I have to say, and really very clearly articulated what the problem is for the workforce, the nursing workforce in this country. But then, as you said, you brought a solution to the table. So what really struck me about your advice to your daughter was never go forward with a problem. You always go forward with a problem and at least one solution. That's excellent advice. So what other advice would you have for young people sitting in this audience today, people who think that they might like to step up and lead a team, whether that's in their own practice within the local community, perhaps in their Medicare local, or perhaps even on the national stage?
I think I was reflecting upon the three stories that Sue just told us about Rachel, Greta and Barbara, and I thought there were some common themes across those stories, and that each of those three individuals had a very clear vision of what it was they wanted to achieve. And then they set about achieving that in a relatively systematic fashion. It may have started small, but they were quite clear about taking the small steps necessary to achieve the vision. But there are certain key dependencies that they relied upon to achieve the vision, and one of them was that they had to engage others. So each of the three of those people wasn't able to do that, I believe, in isolation. They had to engage others, they had to influence others, they had to build coalitions and partnerships to drive the things that they were wanting to achieve. So I guess my thinking is you can have a vision, but unless it's something truly amazing, you're not going to be able to achieve it on your own. You do need to build partnerships. You will need to engage others. You will need to influence others to share your vision. And therein, I think, lies one of the biggest challenges. It's about getting people to share the vision. And if I reflect back to the Productivity Commission report in 2005, which recommended a national registration and accreditation scheme, and I was the CEO of the Australian Nursing and Midwifery Council at the time, and I said to my board, we're going to need to set the ANMC up as an accrediting body. And it was only in 2009 that the board made the decision to do that. And it took a long time. So you have to be patient, is the other thing I would say to you, in terms of getting people to share your vision, because you're not going to get it on your own. You do need others, but you have to be patient. If the vision's worth getting, it's worth hanging in there until you can get everyone on side sharing the vision with you.
Excellent. So partnerships and patience. So Lynne, I'm really interested in your journey really. So moving from APNA into the world of Medicare locals, and I reflect often that at one stage we were actually on opposite teams almost, weren't we? When I was chair of the Australian General Practice Network and you were on the board and I think actually president of APNA at the time. So how have you seen that move for you in terms of A, your leadership, but B, what challenges did you meet, if any, and how did you actually work through those?
I can't remember that, Tony, being on the other side of you.
That was the dark side.
I remember now. Look, I don't know where to start really, because I generally don't have a plan, so I tend to work that way, I suppose. So I never start out really with a particular end in sight, and I know that goes against the whole vision thing, but for me sometimes it's more about taking the opportunities, and that leads you to places where sometimes you don't know that you're going to go. And certainly in those days when we had AGPN and we were on the opposite sides, as you politely say, you know, it was infuriating and it was frustrating and it was annoying, really. But I think persistence was really the name of the game then. You had to just keep banging on about it and hope someone listened and took action. I've been very lucky in my life, I suppose, is one of my greatest role models was my father. And when I'm listening to Karen talk about her daughter, I think, well, you know, one of the things my father said to me is that you can actually do anything you like. So don't be constrained by your own fear of failure, I suppose. And to me, if it seems like a good idea, then, you know, have a go. And the other thing I often say to myself is that, you know, what's the risk? Like, if you think something's a good thing to do, then why not do it and have a go? Because unless someone's going to die, really, what can happen?
Absolutely, and that really comes back to what Sue said. What would you do if you knew you weren't going to fail, really? And look, I was really just being provocative, I have to say. Well, never at odds, I have to say. And I think it's really important because when we look across the primary healthcare body, there are numerous bodies, whether it's in nursing, whether it's in general practice, whether it's in allied health. And really what we need to do is remember that the vision is better access, better health outcomes for the communities that we serve. And I think if we keep that right at the centre of what we're trying to do, some of these difficulties will fall out in the conversations that we have, but we need to keep that focus, I think, and that's important.
I think, Tony, too, it would be good if we all had the same vision across disciplines and so forth. And unfortunately, what gets in the way, and yes, we may have the same vision, but it's how we get there that's quite different and often leads to conflict and so forth. So having the same vision, you know, I think we do actually.
And perhaps being respectful that there are other ways of actually value adding into the achievement of that vision as well.
Yes.
Respecting what different people bring to the table,
Yeah,
and
yes.
then building on the whole, I think is an important part of that as well.
Agree.
Thank you. Sam, what are your reflections on what you've heard so far in the forum, with particular reference to perhaps Sue's presentation and Karen's presentation, but other things that you've heard during the course of this forum?
Jenny this morning at our opening ceremony resonated certainly with me, and I know she did with everybody as well, and I felt that she was very good at saying what probably a lot of us think but have trouble getting it from in here, out here, and saying it well without, I don't know, annoying a lot of people really. Amazing. I think the vision that she has is amazing. And she talked about the fact that we're such a huge workforce. You know, we really are. There's so many of us. And have we ever really, really banded together as one to try and make a difference? And I actually don't think we have. And, you know, certain nurses strike about different things. But I just think that if we can just somehow band together with a goal in mind, figure out exactly what that goal is, that we stand a really, really good chance of actually changing things, which is what we're all trying to do. But obviously, we all try individually, and that's great. But if you can just combine those forces, I think we'll be a lot more powerful. So that's one of the major things that I've sort of taken away from today in particular.
Yeah, and I'd agree, I think, and I'm sure most people would reflect that there are real powers in partnership. It's the coming together that really brings all that energy and enthusiasm and drive. Individually it's difficult, but if you can bring together people, even in a small group, whether that, again, is the local setting, the regional setting, or indeed the national setting. So,
yeah, I just think when I reflect on APNA and a lot of other things that perhaps I've done over my career, just speaking from a personal level, you know, I don't know how the initial thought came to me, but working one day in a treatment room and just having that thought about, and it was something I was doing, and I think perhaps I wanted to know if I was doing the right thing. I sort of knew I was, but it would have been nice to be able to tap another nurse on the shoulder and just say, what would you do if you had this particular wound, or whatever it was I was doing at the time? And then just thinking, gee, I wish I had something that I could belong to, you know, where I could bounce my ideas off other people and I could get everybody together and see what they're up to, and that whole networking thing. Now, if I'd just stopped, and certainly APNA is here today because of an incredible amount of hard work from an incredible amount of people over the course of APNA's history. But one thing that I like to say is, if I had just left that thought as a thought in that treatment room and not opened my mouth and started to speak to people about what I would have liked to achieve, and, you know, is there something I can belong to? No, there isn't. Well, this is what I'd really like to see, a networking group and something that's run by nurses for nurses. I didn't want to hand it away to an administrative body, because back then things were a little bit different too. Some of the nursing organisations, we all tended to work in silos, and it was very much a them and us, and I was very covetous, I guess, of the idea, and I wanted nurses really to be involved. So, you know, I think my message in that is just have a go and talk to people. Like Lynne said, what's the worst thing that can happen? You know, and try and take people with you on the journey, because that's when you'll actually make a difference. You know, and I believe I talk to anyone who would listen to me, you know, anyone at all, doctors, nurses, a journalist, a freelance journalist, and then she wrote my story in the Age newspaper. So you just don't know, you know, who's going to be out there and listening to what you're saying. So you just turn your thoughts into words and share them with other people, and try and get people on the same bus, heading in the same direction, I think.
Yeah, great message.
Yeah.
So thank you. So I think that's seizing the opportunity and then taking some action. So you've actually got to put some action behind the thought. That's great. Thank you. Sue, so look, I really enjoyed your presentation of the three stories, Rachel, Greta and Barbara. But what I want to do is ask you, in your very distinguished career, a professor of primary care, leadership role in the UK over quite a long period of time now, what things have you really distilled from your experience that you could say really have made a difference? And perhaps reflect on a couple of the difficult learnings, because we actually learn from difficulties often more than we do from the positive experiences. So maybe you could reflect on a couple of those for us.
One of the things I think I've learnt over the years, because I've made hundreds of mistakes, maybe thousands, but was seeing things from a practice nurse point of view and not seeing things always from the medical point of view. I mean, I've never been a GP, I've never done doctor training, so I don't understand totally where they're coming from. And then it dawned on me one day, well, they don't know where I'm coming from. And so one of the major things I learnt was, if you want something to progress, like a group of us wanted to develop a career pathway for nurses in general practice, then what you've got to do is engage everybody. Even if you're a bit scared of that, I think, is one thing. Engage everybody right from the beginning, and that was the example of Barbara. So that's the time when they'll give their thoughts, their dissent if they want, and then try and take them on the journey, and they're part of the development. So that was, a sort of a light bulb moment that went for me, and it was difficult for me before I realised that was sort of the tactic to take. The other thing I learnt was that sometimes, I don't know if I'm saying the wrong thing here, you should give up. I've worked in my career very, very occasionally now with people with huge egos, if I can say that. And the main thing they're interested in is progressing their career rather than what you're trying to do, and at the end of it, what we're trying to do is to improve patient care. And sometimes when I've worked with those people, and it's been a very negative experience, I haven't kept banging my head on the wall. I've given up on that and gone in a different direction. The examples of the three nurses I gave, I can honestly say, I mean, we've all got egos, I suppose, but they didn't show. And what they realised was that they haven't got all the skills. I haven't got all the skills at all. But what they were very good at was engaging other people. I think, as you said at the beginning, about that they couldn't do everything themselves. They need to work with other people. And put your egos aside. The last thing I wanted to say with Rachel, for instance, she did this amazing work developing men's health and other health, improving it. And her model was taken across southeast England. Now, when you saw this group type of healthcare that was going on in southeast England, never did I see a banner heading designed by Rachel Chu. It wasn't, nobody knew anything about Rachel. I mean, it certainly helped her advance her career, don't get me wrong. But you've got to put yourself aside sometimes. I think they're the main things I've learned.
Well done, thank you. Don't forget, if you want to make a comment or ask a question, just please put up your hand and there will be a microphone with you in a short time, because I'm interested in hearing from the audience as well. Julianne, I just want to come back to you because, we've heard a bit of this doctor-nurse thing this evening, and that, we have different skill sets, we have different training, obviously, we have different organisations, and sometimes there can be some friction around that. And I know that you have worked with GPs and other doctors in a range of things, whether it's with NETA or whether it's around standards and a whole range of things. So what is your advice in perhaps being able to overcome some of those professional type differences and being able to work through? So how have you been able to lead in that case?
It certainly wasn't easy to start with because it didn't come naturally to me initially. But I was advised once, no matter what, always say something. Always have a comment in a situation, and that certainly was a good breaker. I think that when you start your first steps into the big forums, people actually do still want to know about you. The genuine people, the people that are actually making decisions around the place, do actually want to know about you. So the whole thing that is, sadly, even for me still, there's still a nurse in here. And it's often that nurse that, in particular in January when Matt Hall and I went to see Minister Plibersek, at the end of the day, she really wanted to know what I did and what happens in my daily working life. So be proud and be out there and let people know that what you do on the ground actually does matter. So when you are proud, people respect you. You will always find situations where there'll be a wanker in the group, basically. There's always one at the table. Just move on from them. Just move on from them and go to the one that actually wants to hear from you, the one that you know is interested and that can help you get to the next step.
So speak with passion.
Speak with passion.
With commitment.
Yeah. Definitely speak with passion.
And always evidence-based. Always take your evidence with you.
Yes, definitely. Well, the evidence, we have the evidence.
You do.
Matt's
That's
waving
right.
at me.
And I think it's really interesting, just reflecting on the numbers for a moment. I mean, 11,000 practice nurses, 60,000 primary healthcare nurses. I mean, that's a great, Judy, I'll come to you in a moment, sorry. That's a great opportunity, and it's really about harnessing that vitality in that membership group. Judy Evans.
Thank you. As I have had some wonderful opportunities in speaking with lots of practice nurses around the country over the last couple of years, there's a constant theme about feeling disempowered, and I'd really like to do this, but, and take Sue's comment of turning that but around. But I'd be interested for the panel to maybe comment on that sense of disempowerment and if they've ever had it and what they actually did to get over it or to make a difference.
Thank you. So Karen, we might just start with you.
Well, I would have to say that in the 4 years that I waited for the ANMC board to make the decision to seek appointment as the accrediting body, there were times that I felt very disempowered, and I certainly thought of giving up. And I can remember someone ringing me and offering me a job and me saying, no, I can't take it. I haven't finished my business at the ANMC yet. I have to hang in here because this is what we need to get, because this is what all the other professions have got, and so this is what we're going to have for nursing. So yes, you can feel that you're disempowered and you can feel that no one's listening, but if it's worth doing, it's worth doing. You have to remember it's not a popularity contest. So, if I go back a bit further, there was a situation when I was the registrar of the Nurses Board of the ACT, and we had a shared office with the Medical Board and all the allied health boards. And the business processes in that office meant that the enrolled nurses were subsidising the allied health and the medical professions because all of the costs were on this per capita basis, and we were the biggest profession, so we paid the biggest costs. And I thought, well, I'm not having this. Now, the average enrolled nurse in town had no idea. She didn't know. I thought, bloody hell, if she did know, she'd be very upset about it. So I turned the whole place on its head, even to the point of getting a tape measure and measuring how much office space each group was using. I thought, I'm not having this. This is over my dead bloody body. And we turned the whole thing upside down. And the allied health professions and the doctors had to pay a lot more. And then with the extra money that I then had, I could do more things for nurses. And it wasn't long after that that we were setting up the national registration and accreditation schemes, and one of the first things I said is there will be no cross-subsidisation by any profession of another profession if it's going to be self-regulating. Now, the fellow who ran the Allied Health Boards at the time in the ACT to this day does not speak to me. So Watsky.
Well done. Lynne, what about your reflections on feelings of disempowerment through your career and leadership?
Well, I think that disempowerment is really a self thing, like we disempower ourselves. So, you know, I think there's not a person in this room that can't really do whatever it is they want to do. You know, they're well educated, they're healthy, they have jobs, they have, you know, we have a very good, you know, way of life here. Whatever it is you want to do, why don't you just do it? So I think disempowerment is sometimes comes from within, and you let other people have power over you. So for me, the first thing would be about changing the way you think about yourself, and that it actually is possible to do almost whatever it is you want to do. I'm just thinking that someone who's probably in the room actually, but said to me once, "Oh, you're never happy." And I said to her, it actually isn't about being happy, it's about doing better. So yes, it isn't quite good enough at the moment, but gee, I reckon next time we can do it better. So, you know, just the mindset that people have plays out in the way that they behave and in the way that they think and what they actually achieve. And so I think disempowerment for me isn't a problem because I don't feel disempowered, really. Not sure that I ever did.
Yeah,
maybe
excellent.
I should have, but I didn't.
Excellent.
And I've got 5 brothers. I mean, how could you be disempowered with 5 brothers?
That's right. Sorry. I can't see. Jeff, sorry.
Sue, I think you sort of answered my question, but so far we had heard a lot about leadership, about getting common vision, and in a sense, I guess, consensus. And I think that implies a team. What you talked about was, I think, conflict. It was a win-lose situation. There probably wasn't a team. So when, as a leader, do you decide that it actually is about winning, which means maybe someone loses, as distinct from trying to get the common vision?
I don't think...
Sorry, it was... No, it wasn't you, Sue. It was... who was it? Karen. Sorry. Karen.
But Sue, you go ahead. They must be sick of me by now, surely.
Never.
Oh, God. All right. What was the question again? Because I thought it was Sue's question, so I kind of had a little bit of a, daydream
Is
there
it
for a minute.
okay for there to be winners and losers, I think, is a really important thing, or do we have to take everyone along on the ride?
I think, obviously if you can take everyone along, then usually you're going to be more successful. But no, you can't. You're not always going to. I mean, my journey in terms of the financial stuff, we didn't take everyone along. When we were arguing for regulation of nurse practitioners in the National Registration and Accreditation Scheme, we didn't take everyone along. But it was still about the ultimate goal and the outcome that you wanted to achieve, and it was about sufficient people sharing that vision to achieve that outcome. But I don't know that it's about winners and losers. I don't know. Sue, what do you think? That's not a terminology I'd really use in this space.
I was going to say that what I think I would do is try and collaborate with people, which you did in your example. Give them the opportunity to be involved and to have their say and be part of the development of whatever it is. And if they choose not to, then that's decision, and that's fine. The other thing I would say, when you're, I suppose in any role, in a professional role in nursing, as well as being in a leadership role, it's all about respect. I mean, my family hopefully love me, my friends love me, hopefully. I need not to be that interested if everybody likes me. and it's about whether you gain respect. And if somebody doesn't agree with your decision and values, it doesn't mean to say they will lose respect. They might not like you, but that should be absolutely fine. And it's about respect, and it's also about not losing the passion of what you think the right goal is, which is what you're saying, and sticking with it.
Thank you very much.
Sam spoke a moment ago about the dream of bringing a group of people together with a common cause, and I just wondered from each of you, where to next? We've all heard lots of information, but what would you like to see? What would be the next step in the vision?
Sam, yeah.
I guess if we get back to the question that Sue put up on her slide at the end, you know, what would you do if you knew you were going to succeed or that you wouldn't fail? And obviously, probably not everyone's going to agree, and that's fine, because it is okay if you know, we don't all agree, and you don't have to like all of the people all the time, and not everyone has to like you, and I say that to my children a lot. But I haven't put a lot of thought in the how, but I'd really like to see in the future that nurses who work in the primary healthcare industry actually have perhaps a general item number that actually belongs to them, that they can see patients and bill an item number that's rebatable by Medicare, just as a GP does, and just as allied health professionals have access to public money, and naturopaths who, and no offence to any naturopaths in the room if there's any, it's a real highly unregulated industry. We're highly regulated as nurses. We, you know, like we're having to evidence-base more and more things, which is fine, but you know, we're a highly regulated industry. And yet, if I look at an allied health professional and I look at a nurse, we've been to university for the same amount of time, and yet there seems to be a slight disparity in where we sit on that, you know, I don't know, hierarchy, I guess. So I would just love to see that we get to the point where what we're capable of is acknowledged. And I'm not saying that somebody straight out of university could have an item number or provide a number. That's not what I'm talking about. I'm talking about the career pathway that's been mentioned over the last couple of days that we are working on, and that when you reach that certain level within your career, and some will reach it earlier in their career, that you're able to, you know, access and provide care and make a difference. So I guess if I knew I wouldn't fail, I'd travel the world, I'd go to South Africa, I'd go to Switzerland, and I would see those countries where nurses are doing that. They're actually the major providers of care, and I would gather all that evidence, and I would come back and I'd grab a whole lot of people and get everyone together and figure out what we do with those models, take the best from everything, put it together and go to the government and have a big argument.
Perhaps just one last question or comment.
This is probably going to be quite provocative, and it's probably a good question for the end. I've actually practiced in 4 countries. I am a registered nurse in 2 countries, US being one of them, and an allied health professional. And I've worked in lots of dynamic teams in the private sector and non-profits and so forth, for profit, for volunteer completely. And in Australia, and I am Australian, it worries me, and I see it today, and I've seen it yesterday, and I see it permeate all the time. And we're talking about leadership, and things that we need to get going and doing, and respect, and, you know, partnerships and so forth. Yet we see one GP on the podium, and in GP forums, and in GP arrangements that I engage in a lot, and particularly the only allied health RN that received research in a GP-funded environment, and the shock that was there, that, you know, the courage that a nurse presented and was actually given the money to proceed with this research. We need a partnership much stronger in a relationship and an engagement on a regular routine basis at every single level with our partners, our very well-respected colleagues, our GPs. And the nurses that have gone on to be GPs, I think, are the conduits for that process. And I think we need to harvest and find these nurses that have gone on and become doctors and bring them back through the portal and to make this constellation brighter, because that whole Milky Way out there is all of us. And we can see the path, we can see the stars. There's many stars out there. There's a lot of planets too, by the way, but the GPs out there and the nurses really need to come together on a global level, but particularly here on a home level. What are your visions and ideas, and what's APNA's plans for the future for that engagement?
Okay, thank you very much. So Julianne, I might ask you just to respond to that, and then I'm actually going to ask Judy Evans maybe to give her reflections from an intra-college perspective as a nurse working within a GP organisation. Julianne, first.
The one thing that Stuart forgot to mention when he was talking about Tony as an introduction, and one of the sad things, I'm sure, for Tony was when he took up his new position, he left the APNA board. And having Tony on the board was a wonderful thing. He was a GP and a rural GP. That was certainly valuable and certainly been very valuable for him throughout his career in the big agendas. But for us, he brought governance skills, and that was incredibly important to us, and brought us the policy and the lobbying knowledge that certainly gave us a lot of momentum over the 2 years that we were really very lucky to have him, and we'll miss that, but we've moved on. So we've started those sorts of journeys, but APNA certainly is very involved with just about every GP type forum, and we are invited now. So things have changed in the time that I've been on the board or been in APNA. Our new vision is a healthy Australia through best practice primary healthcare nursing. I think that's it's certainly aspirational, and I think it is something that earlier Sue said, I think not earlier session, she said that we need to outlaw tribalism in nursing. And I think that is the elephant in the room at times for nursing. So I think until we do that ourselves in our own profession, and we get together and we work out what the big agendas are that we can work on together to look at this vision that APNA has of a healthy Australia through best practice nursing, then how can we expect to mesh with other professions that also have their tribalism? I think the first step is to get it right with nursing. And I think we're on the way. I'm really hoping so anyway. Does that help?
Thank you. Judy.
Thank you, Tony. Is it working? Yep. History. It's interesting that when APNA was very young, when I first joined the board, APNA had its offices in the RACGP. And that was fantastic. Now, one day I hope in the future that will come back again. And from an organisational level, whenever we are developing a resource, we always have a practice nurse wherever possible. Julianne's been on the standards committee for a number of years now, so nurse input into the RACGP standards for general practice, the infection control standards, the pandemic flu kit, the red book, the green book, the quality health records project, which Karen has been representative of, all our telehealth. So in fact, the college invites APNA to nominate a representative to be on these committees, because we do talk about the practice team. Sometimes we talk about it and don't do a lot about it, but it is this early stage of engagement. And we also do the same with the Practice Managers Association. Kathy has met with the CEO myself and Roald Verstaeg, who's the policy manager, has met with Cathy in her role of CEO. So there's actually a lot of behind the scene works that I think probably haven't been visible to the membership, and maybe that's something that could be addressed in some way. But there is actually a strong connection. Ian Watts, who was on the board, and he's still on the board. Ian Watts was my boss at the RACGP when I first started. So I think there is quite a good collegial working relationship. What we need to do now is actually have that reflective on the ground in the general practice setting. And I think that's, and I agree with you, we've got a problem in that we haven't been able to build that ethos of teamwork in the general practice setting as much as we would hope. And I think sometimes that's because of GP attitudes and sometimes it's because of nursing attitudes. And I think sometimes nurses work in environments where they actually should go and get another job because they're not treated with the respect that they should be, and they sometimes are encouraged to be complicit with poor care pathways and poor billing processes. And I think that's a problem for the sector as well. That's probably enough from me.
Well done. Thank you very much. So I'm just aware that we've actually gone a little bit over, but I think this has been a really important discussion for you all. So I just want to reflect from my perspective just what I've heard just in the few hours that I've been here today. So we've heard about the importance of partnerships, the single person absolutely, but strength in partnerships, and I think we'd all agree about that. Patience and persistence, I think that was a common theme coming through, and certainly in my experience I think that's really important. And I can tell you in my present job that's extraordinarily important. I've gone from a job where I will see very concentrated amounts of effort based on a very strong relationship with the person or persons with some sort of an outcome every 20 minutes, half an hour or whatever. Sometimes I go home, my wife says to me after 12 or 14 hours, what have you achieved today? And I go, I'm not sure, but I'm sure it's moving in the right direction. So that theme of patience, persistence, working to the goal, but being realising that it might have some time factor, and I think Karen spoke about that really well. The passion is really important, and I think you would have heard from all of these speakers today about the passion that they hold. And in those hard times, when you do rub up against difficult situations, when you do have disappointments, it's the passion which will really take you forward. So I think that's really important. The other thing that I did in preparation for today was I actually went to Google. You know, Google's a great search engine. And went to a leadership style survey. And I just encourage you all, if you haven't done it, just to go and have a look at that. It takes just a few minutes, and it'll be really interesting for your self-reflection wherever you are in your leadership, whether you're just at the beginning or like Sue, you know, you're on the international stage, just to reflect about your leadership style. So for me, I'm participative, I'm delegative, and I'm sometimes autocratic. And not surprisingly, leadership is contextualised, and sometimes we need to exercise different roles, different parts of our leadership style for different situations. But I think for me it's more the participative, the democratic, it's the bringing along with you style that really works best for me. So look, I want to thank you for attention. I do want to just reflect on Sue's parting comment. What would you do if you knew you weren't going to fail? So I think that's your challenge, and it's your challenge for your organisation, for the Australian Primary Care Nurse Association. So thank you very much, and please join with me in thanking this excellent panel. I'll hand back.